Hi, Dr. Lee Osler here. I wanted to share with you a recent piece of research that came out talking about the link between gum disease and Alzheimer's, dementia, and cognitive decline. This was published in the PLOS One magazine, PLOS, back in 2018, but this is something that we've known about for quite some time. But it's nice to see some definitive literature come out. This is tying bacteria, that specifically in this one called Porphyromonas gingivalis. We call that PG just because it's tough for most people to pronounce. But it was found in the brains of humans and mice with Alzheimer's disease. This research team decided to focus on this because what they noticed was that there was a change in the glucose metabolism in the brains of these laboratory animals that had periodontal disease, and so they began to ask the question if there were any other linkages to the rest of the body with regards to systemic diseases there. What they showed was that these laboratory animals that were exposed to this bacteria that causes gum disease, that they showed signs of degeneration, inflammation, and senile plaque, or the beta amyloid plaque that's characteristic of Alzheimer's diseases in humans. They make the comment here that they were surprised that her team discovered this, since the type of animals that they were developing do not normally develop this type of plaque. She said that the researcher, Dr. Watanabe, said that there's two possibilities here. One, bacteria or its product may be directly influencing the beta amyloid production, and two, just simply the prolonged exposure to the periodontal bugs resulted in a significant amount of neuroinflammation in the absence of aging. They characterize this as a landmark study that may influence distant organs in the body from the mouth, such as the heart and the brain and so forth, and the linkages there with neurodegeneration. So the take home from this is that we don't want these periodontal pathogens or bacteria to be in the mouth, and that's what gum disease is. We actually now have bacterial DNA tests that we can use to identify these specific bacteria and to determine whether or not they're present and if there's a risk there of developing this. There are various studies out there. Some have put the increased risks as high as 20%. People that have gum disease on average for having increased neurodegeneration issues, at least they've seen the correlation there. This is a pretty big risk, and so my advice to you is that you have your mouth clean, both at home every day and periodically as you come visit us at the dentist or whatever dentist you're going to. Just make sure that it's a regular thing, and if we're worried about this, if we have gum disease, it's a good idea to have a bacterial DNA analysis to find out if we've got the specific bacteria that we now know in the literature is associated with an increased risk for this Alzheimer's and neuroinflammatory or neurodegenerative or cognitive decline dementia, however you want to characterize it. It's the mouth-brain connection. We now have the literature. So I wanted to share that with you and encourage you to be well and be happy. Thank you.